Hi, today we will discuss a frequently asked question about hypospadias surgery. We, our hospital, we perform about close to 200 hypospadias operations every year. A lot of parents, when they come to us, they ask us this question, Doctor, my child is already 6 months old. Should we operate his hypospadias right away? Because we read on the internet that the best age to operate hypospadias is between 6 months to 1 year. Now, it is true that the if everything else is okay, hypospadias surgery may be performed between 6 months to 1.5 years of age. But that's not the only criteria. Age is not the only criteria. In my practice, the more important criteria to choose the correct timing of hypospadias operation is the size of the penis. If the boy with hypospadias has a small penis, then doing the operation on a small penis can increase the chance of complications and failure of the surgery. That is why we always measure the size of the penis in boys with hypospadia. There are specific measurements which can be done. And only when we reach at least a minimum required size of the penis, we actually operate on those children. So, age is okay, but more important is the size of the penis. For example, if a 1 or 1.5 year old child comes to me with hypospadias and a small penis, I will not operate immediately. Normally, the child's penis grows naturally in the first 1 year of life. After 1 year of age, after the first birthday, there is not too much of increase in size again till puberty, because the hormones responsible for the penile growth are not produced in the body physiologically. So, in case so we typically wait till about 1 year of age for the penis to grow in size, and in case the child's penis is much smaller than the required size for surgery by 1 or 1.5 years of age, then we increase the size of the penis by giving testosterone hormone to these children. Now, we don't give hormones to all children with hypospadias. Many children with hypospadias by 1 or 1.5 years of age reach a reasonable size of the penis and can undergo surgery. In some children with hypospadias, especially those with very severe forms of hypospadias, but sometimes even the milder and moderate forms of hypospadias also can have a small size penis, even by 1 or 1.5 years of age. That is the time we use 1 or 2 doses of testosterone injections to increase the size of the penis. There are testosterone creams also available which can be applied to the penis, but there are some issues with the creams that you cannot be sure what dose is actually going into the child and what dose is being absorbed. So, the best way, at least what we follow, is we give 1 or 2 doses of testosterone injections. We know exactly how much dose we are giving for that child's body weight, and then once the size increases, after about 4 weeks after the injection, we go for surgery. There are very severe forms of hypospadias which form about 5 to 10% of the hypospadias cases that we see, where the penis may not increase in size even with 1 or 2 doses of testosterone injections. Previously, we did not have much to offer to these children. We used to use higher doses of testosterone. But now we have some special hormonal creams that are available for these particular group of children. They have started, we have started getting them in India for the past 6 months to 1 year. Previously, they were not available. So now they are available and we can use them, and they are very useful in increasing the size of even these very small penises so that we can go for surgery and ensure a good result with good success and low complications of the surgery even for these children with very severe hypospadias and a small penis. So to summarize, it's not only the age of the child that is important to decide the timing of hypospadias surgery. In my practice, a more important practical point is what is the size of the child's penis. And please remember, operating on a small penis may actually increase the chance of complications and failure of surgery, and we do not want that to happen.